Pennsylvania Health Access Network, PHAN, held its 11th annual conference on October the 28th, 2019 in Harrisburg. Advocates, legislators, and healthcare providers came together to discuss current topics in healthcare reform and the Affordable Care Act.
Starting next year, Pennsylvania will be transitioning to a state-based exchange. Right now, there will be no changes, but starting next fall, you'll be able to enroll in the state-based exchange, and we expect premiums to go down anywhere between 5 and 10%.
Policymakers acknowledge the need for this change because it had been proven to work in other states.
And a health insurance exchange really empowers a state to run its individual market, to run it in the way that we think is best, to reach people in our state the way that we know that they need to be reached, and really to focus on stability when the federal government is creating instability, to focus on access when the federal government is restricting access, and all of those things.
While it had been difficult to find common ground on the national level, Pennsylvania representatives were able to achieve bipartisan support for the law and bring savings to the consumers.
And we had an opportunity to have a bipartisan discussion with the Republican leader of the House, Brian Cutler, found areas that we've agreed upon, areas that we may disagree upon, but I think we both have concerns about making sure that all Pennsylvanians have access to high-quality health care at a reasonable cost.
When you look at the cost drivers, and this is what the Care Connections and many of the programs that are built in a similar way have realized, a very large portion of the costs are actually created by a small portion of the patients. So if you can help them get what they actually need, you can lower the cost for everybody else. It's massive. It is a lot of data, observations and mining and understanding what's driving those behaviors, but it's immensely important in terms of potential payoffs for us, and then I think we need to recoup that at the state level through our capitated rates.
When I look to my role as controller, the most important thing I believe I can do, or any elected official can do, is to really be an advocate and to be a voice for the people whom we have the honor of serving. That it's not about us, but it's about making sure that we elevate those voices.
PHAN also recognized healthcare heroes and community activists who committed time to advocate and tell their stories in order to move forward the state-based exchange system.
And it is not a small group of powerful people sitting in some boardroom thinking only about profits and not about patients who are the actual stakeholders.
It was sad to watch during the board meeting these 17 executives that held the future of my health care in their hands, playing on their cell phones, not paying attention to anything. But I made sure that they listened to us.
We would still be a bunch of individuals wandering in the night, probably now without access to our doctors. But with that leadership and with that support, we were able to move a mountain.
Enrollment in the state-based exchange will begin 2021. Tia Whitaker, the statewide director for outreach and enrollment with the community health centers, will help people navigate this new landscape.
People are able to come to community health centers across the state and meet with navigators and certified application counselors to get information and assistance in enrolling in the health insurance marketplace.
Reporting from Harrisburg for PhillyCAM Voices, I'm Donald Terry.